Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Good day to everyone, and welcome to the Heart of Health Live, where you are the program. And if you want to be a part of today's program, give us a call, 855-644-3278. We have something real neat to talk about tonight. We have an electrophysiologist. And what an electrophysiologist is, a doctor that specializes in the electrical rhythms of the heart. So if you might have a question about that, if you might one that has a defibrillator or a pacemaker, have some abnormal rhythms, well, this is the place you want to ask your question tonight. Dr. David Salerno is with us here live. He'll answer your questions. And I've worked with Dave for a long time, and he can answer almost any question that comes in regarding the electrical properties of the heart. And if he can't answer it, we'll look it up. So give us a call, 855-644-3278. You know, when we talk about rhythms, everyone there's sort of like a rhythm to life. There's a rhythm to your heart. And if you just sit there right now, if you feel your pulse, that's your heart rhythm. And normally your heart rhythm usually runs it can go from 60, sometimes lower. If it's going really fast, above 140, 50, then that might be something you might be concerned about. But everyone has a heart rhythm. We're going to talk about that today on Heart of Health Live. You know, Heart of Health Live, every week we come and we just give you answers to your medical questions. We don't sell anything. We're not trying to promote any products. We just want to serve you. We just want to help you have a better quality of life. And some people don't have time to get to the doctor. So if you want to ask your question, we just want to serve you, give you some good information. Some people have called in. We found out that they had serious problems and they've actually gone to their doctor and it's helped them tremendously. So we hope you're not one of those, but we want to answer your questions. After the break, we're going to be back with Dr. Salerno. He's one that's practiced medicine for a few years now. He's seen patients. He's a real doctor. He's not a television doctor. He's real. He sees patients every day in his office. So stay with us, but more than that, we want to hear your voice tonight on Heart of Health Live. Give us a call at 855-644.
We'll return in just a moment.
Dr. Salerno will be back after this break.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol, because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
My life is full of statistics. Thing is, I could have dropped out of school and become one myself, but I didn't, because I had people that believed in me. Here's another statistic. 7,000 students drop out every school day. That's 1 every 26 seconds. It's time that students know that we believe in them.
Inspire a student and share your message of support at boostup.org.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, you're glad you stayed with us after the break, and if you notice, I kept talking into the commercial. That was to really confuse you a little bit as we go on here, so to make sure you're really paying attention and listening. We have Dr. David Salerno with us. He's an electrophysiologist at the Chattanooga Heart Institute. He knows all about the electrical properties of the heart. Dave, we want to welcome you to the Heart of Health Live.
Thank you, Jim.
Now tell me,
Pleasure.
what got you interested in studying about all this neat stuff about the heart?
Well, while I was in training as a resident and a cardiac fellow, I trained in Seattle, and at that time, the senior physicians in Seattle had set up the first 911 system.
Okay.
And we were seeing people who were rescued from cardiac arrest at home, and they would wake up and get well, and we had no idea what to do with them. I just got very interested in that, talking to those folks, and the field started to grow as people learned what to do, and I've just stayed with it ever since then. That was back in the mid-late 70s.
So you have to go to school for this, right?
There is now full formal training in cardiology as a branch of cardiology. People do extra training in heart rhythm management. That's called electrophysiology. We make up a lot of difficult words so that we look smarter than we really are. But it means take care of the heart rhythm problems of the heart, electrophysiology.
And here's a question. Do you actually see patients every day?
Oh, yeah.
Okay, so you're
We
a
sure
real
do.
doctor, right?
Yes, sir.
Okay, real
Well,
patients, real problems.
We stay pretty busy.
Well,
Yeah.
we like to tell our audience that we see real patients
Yeah, we
because it
do.
sort of sets us apart. Some of the doctors don't see as many patients, but I guarantee you my guests on average see more patients per week than any other medical program out there. I would dare say.
We stay pretty busy.
Well, you ready to answer some questions?
Absolutely, I'd love to.
Lawrence, you're on with Dr. Salerno. What's your question or comment? Go ahead.
Yeah, my grandpa's got the defibrillator.
Okay.
Go ahead.
And
Lawrence, we're going to come back to you, but you need to turn down your television set, okay?
turn down the television.
Yeah, turn down that television set. We get a little feedback there, okay?
Is that better?
Yeah, okay. Go ahead, Lawrence. You're with us? You got a question, Lawrence?
Yeah, my grandpa's got the defibrillator, and ever since he's had it, he's been tired.
Okay, he probably got that defibrillator because his heart muscle wasn't pumping strongly enough. And it's not the defibrillator that makes him tired, but the heart condition that led to him receiving the defibrillator in the first place. A defibrillator in itself doesn't necessarily help a person feel better. Its primary function is to protect him from serious heart rhythm problems that might put him in danger. So the defibrillator just watches his heart rhythm all the time, and if something were to go wrong, it would correct it for him. Its primary method for doing that is to deliver a shock, as you may know. It gives a person a shock inside. Some people feel it, some don't. We had a fellow the other day who came in for a checkup, and he'd gotten a shock while he was sleeping the day before Christmas.
After that woke him up?
It did not.
No? Okay, slept through it.
Probably saved his life. He didn't even know it.
Wow.
It's pretty.
Lawrence, did you have any other questions?
Yeah, He has to get blood put in every week. Well, he has to get blood put in a lot.
Well, it sounds like he has a transfusion. Maybe?
I think you mean blood transfusion?
And his legs are always getting water in them, too.
Yeah.
Yeah.
Those are, you're describing things that we see with folks whose heart is not pumping hard enough. As I say, that's a heart condition that's bothering him and making him feel badly. And sounds like his doctors are treating those conditions for him.
Well, Lawrence, thank you, and we just hope your loved one starts doing better. Okay.
All right. Thank you very much.
Thanks for calling. Well, they brought up a defibrillator. A lot of people don't even know what a defibrillator looks like, Dr. Salerno. Can you sort of?
Well, I brought in some. I've been at this for a while. I have had the opportunity to save some models of defibrillators. In the early days when they were first put in the 1980s, they were very big, and a thoracic surgeon had to put two patches that they were actually almost like fly swatters, patches on the heart itself, and then tunnel the wires into the belly, and this would be under the skin. And you can't feel the weight of this, but I promise you, it's heavy. And this would be an original model defibrillator. And over the years, they've added more and more features to a defibrillator and to what it's capable of doing, and managed at the same time to reduce its size. So this would be a modern size defibrillator. It's just enormously smaller. There's almost no comparison. And this probably does 1,000 times more things than this very simple but bulky device. These go up here in the shoulder now and through the vein and don't require thoracic surgery any longer.
Now, why would a person get one of those?
As I mentioned earlier, the primary function of a defibrillator is to monitor a person's heart rhythm.
Okay.
Watching to make sure if something were to go wrong, it would treat it right away. It treats that heart rhythm that's going too fast and putting a person's life in danger. It treats it with a shock.
Okay.
People tell me they don't like the shocks. They tell me it hurts, but they're also glad they got it.
So it's sort of like insurance, right?
It is. Some folks never need a treatment from it, but they're sure grateful if they do need a treatment and they're rescued.
Now I know that those treat the dangerous fast rhythms.
Right.
What about slow rhythms?
Well, slow rhythms can cause a lot of trouble too, make people weak or tired or faint. And they're treated by speeding up the heart rate with a pacemaker. Okay. Pacemakers for slow heart rates, defibrillators for fast heart rates. This is an old pacemaker. You can see it's about the size of the new defibrillator. And this is a new pacemaker, modern day size. You see they've come down a lot in their size from their original. There are older ones even bigger than this, but they were also pretty big. Pacemaker speeds up a slow heartbeat. All defibrillators, now I get this question a lot, do I have one of those defibrillators that has a pacemaker in it? The answer is always yes. All defibrillators have all of this inside.
Wow.
In addition to being a defibrillator, they also have pacemaker technology. So this is an amazing unit here for all it's capable of.
That's great. Well, you know, I hope that no one out there has defibrillators or pacemakers in, but, you know, out of all the things modern medicine has to offer, you know, before people had these devices, people would die suddenly from defibrillators, kept their heart rhythms going. If their heart was going too slow, it would go slower, slower, and slower, and stop. So these are great places where modern medicine helps a lot. Beverly, stay with us. We're going to be back, and Dr. Salerno is going to answer your question. Everyone go get a drink of water. We're going to be right back after this short break on Heart of Health Live.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're talking with Dr. David Salerno. He's an electrophysiologist. We talked a little bit last section about pacemakers for slow heart rhythms, and we talked about defibrillators for fast heart rhythms. Now we're going to ask Beverly. Beverly, do you have a question for Dr. Salerno? Beverly, are you with us? She's calling from a long way away.
Yeah.
Beverly, go ahead. You're with Dr. Salerno. Go ahead.
Me?
Yeah, you, Beverly. Fire away.
Okay. My name is Deborah.
Oh, got the name wrong. Sorry.
I wanted to ask the question that when a person is laying on their back or laying on their side, does that cut off the oxygen, for them to breathe, and would that mess up the rhythm of your heart?
You mean when you're lying down?
Yes.
It shouldn't. We all have to sleep at night, and that does not cut off our oxygen unless we have a medical condition called sleep apnea. Now, I don't know if you've ever heard of that, but that's a condition where people don't breathe easily at night, and there are wonderful treatments for that problem. Because if you're not breathing properly, you won't have enough oxygen at night. But for most people, we don't have problems while we're sleeping. The way to know whether you might have such a problem, a person would suspect it if they were restless all night long. Maybe their family say they snore a lot. And then during the day, they'd be tired all day because they didn't sleep good during the night. Fall asleep reading the paper, watching TV, maybe drowsy driving. Those would be clues that they might have this sleep apnea condition. But for most of us, we don't have a problem when we lie down.
Are you having problems at night?
Yes, I'm having a problem. I'm trying to learn how to sleep on my back because I think that it has a problem with me getting oxygen at night. And I also had 2 stents in my heart, one at a time, and I just think that my strength as far as trying to carry something also is giving me problems. I can't carry like I used to. With that have to do also with rhythm.
Well, your doctor would, it's possible that you have a rhythm problem, but your doctor would be able to figure that out pretty easily by, first of all, checking your pulse and listening to your heart. He can hear the rhythm. And if he's not sure, there's tests like a simple electrocardiogram, the EKG. And then there are some monitor tests where you take a little tape recorder home for a day. It's called a Holter monitor, named after Dr. Holter. But there's lots of ways to figure out if you do have a problem with your heart rhythm. We're fortunate to have technology now that can help us get to the answer on these kinds of symptoms. I should mention, if you think you might have sleep apnea, for anybody else who thinks they might, who's listening, it's probably better to lie on your side. On our back is where we have the most problem with sleep apnea. Wouldn't you agree, Jim?
I agree.
Yes, yeah, and that's outside my field, but nonetheless, I think that's pretty standard advice for people to lie on their side if they suspect they have trouble breathing. Our airway stays open better when we're on our side.
And let your doctor know about the way you're feeling at night. He might want to even put a monitor on you so he can see what your heart's doing in the middle of the night, okay?
Right.
Right. I think I've had my heart monitored before.
Oh, good. Okay.
But
Well,
thank
you for calling.
I still think. All right, thank you.
Okay. Reggie, you're on with Dr. Salerno. Go ahead. What's your question, Reggie?
Well, not specifically with the heart problems. A number of years back, we used to do some food allergy testing, and the thing that got my attention here with your program was the electro aspect of this, and which deals with the nervous, your electrical energy of the body. There's a, what do you call it? Anyway, machine, computer, basically is what they use. They call it the electrodermal. And it uses computer, and I've seen it used in connection with the skin testing too, and they found it was always the same, so they went to the electrodermal computer, which is much quicker. And it works, I guess, on the principle of your electrical, what do you call it? Your nerve impulse in the body. Some say it's on the basis of this, what do you call it, universal energy.
Yeah, Reggie, do you have a question here for us?
Well, I was wondering if there might be any knowledge and understanding of this, the reliability, of this electrodermal, used like in food allergy testing and that.
Have you heard of anything like that?
Well, Reggie, you're way outside my area of expertise.
All right.
But there are electrical signals throughout the body.
Right.
The heart signals, you can pick it up in the feet. Every nerve of the body really is a living wire.
Right.
That transmits an electrical signal. So we can record those, and I'm not familiar with the machine you're referring to, whether it's capable of evaluating allergies. So that's just something you'd have to ask an allergist.
If you think of an allergist, of course, is going to cause an immune reaction.
Right.
Okay? But most allergists, for food allergies, there's other ways they test your immune system with skin testing and things like that too. That's pretty reliable to see what you're allergic to. So we don't really know much about that, Reggie, okay?
Yeah. Pretty neat. Put your finger in a machine.
Well, it got my attention.
Yeah. Well, you know what? I'm going to look it up tonight and see if I can learn something about electrodermal. I'm going to put it in my computer and see if anything comes up. And that gives us something to talk about later, Reggie. So appreciate you calling.
Yeah.
Thank you.
some say this borders on the line of what they call this New Age, energy stuff.
Yeah, like I said, it's not something that I'm very familiar with, but we'll look it up, and if we find anything out, we'll let all of our viewers know about it. Appreciate you calling, Reggie.
Yeah, all right.
Okay, we have a caller that I don't know your name because it's not in there, but we lost you earlier. But go ahead and ask your question to Dr. Salerno. Go ahead.
Yes, I would like to find out. Sometimes when I overwork my body, what has happened? Sometimes I get that heartbeat, boop, 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 and it's gone.
Okay.
So, and sometimes I'm suffering with anxiety, so I don't know what had caused it.
I think you said sometimes you feel a thumping or a pounding inside. Did I understand you right?
Sometimes my heart gives me this.
Yeah, those are very common symptoms, and fortunately they're not dangerous for most people. They're called premature beats. A lot of people describe them as skip beats. As it turns out, almost all of us have those. If we put a 24-hour recorder on ourselves, we'll see 95% of us have those. Surprisingly, not everybody feels them, and they feel very funny when they occur. So I'm sure they catch your attention. Once again, your doctor can figure out what they are pretty easily with a little recorder of the heart rhythm.
Now, when should someone be worried about that type of beat?
Well, I think if they're happening a lot, all day long, if you have it, say, 1 or 2 beats in a week, don't need to worry much about it, I would think.
We got to go to break.
Okay.
Stay with us. Give us a call, 855-644-3278. We'll be back with you after break, Beverly, so stay with us.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum with your medical moment. I don't know about you, but I get thirsty if I talk a lot. Well, one of the greatest needs of our body is water. Did you realize that up to 70% of our body is water? All the chemical reactions from the brain to the heart beating to the muscles moving all depend on water. It's one of the most important substances we put in our body. If we get dehydrated, many bad things happen. We can have inflammation, we can have the blood thickened, we can have blood pressure changes, we can even have our heart race. You don't want to be walking around in the desert. Hydrate yourself. How much do you need? Divide your weight in 2, that's about how many ounces. Or drink enough water till your urine comes out clean. Remember, water is one of the most important ingredients we put in ourselves every day.
To learn more about your health and discover what Dr. Marcum is doing in your area, visit heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're back on the Heart of Health Live. We're talking with electrophysiologist Dr. David Salerno. We've answered some questions about defibrillators and pacemakers, and we're on the line with Beverly. Beverly, you still with us?
Yes, I have so.
Okay, well, you have any more questions about these funny beats? Because Dr. Salerno wants to throw some more information your way.
Yeah, we didn't we didn't get
just
everything
make me feel
in that I
very
wanted to tell
scared.
you.
Sometimes I have anxiety, so sometimes it makes me feel very scared.
Anxiety.
Yeah, they're. I have a few. They feel pretty strange. They can make a person very worried, and this is where doctors can help you by a few of these are important, but most people they're not dangerous. But we can tell the danger based on a couple of clues. One of them is, do you have other kinds of heart trouble? For example, people who've had heart attacks or something, maybe those feelings might be more important. Or if you have feelings like you might be fainting or actually do pass out, that would be a much more important symptom.
Yeah.
So
No, I don't have these signs.
so if it's just, I call them flippity flops, skips or thumps, usually those are harmless, but if you're worried about them, I'm sure your doctor will be able to help you figure out what they are and what, if anything, is needed to help you with them. Most of the time, they don't need treatment, fortunately.
Anything else, Beverly?
No, well, thank you very much. I really appreciate it, and I would continue watching A3BN and continue doing a good job. May God bless you all.
Thank you, Beverly. There's so many things. I tell my patients, anything that puts stress on the body makes adrenaline.
Oh, yeah.
And that can cause palpitations.
Right.
People don't think about like the energy drinks, too much caffeine, not drinking enough water, not sleeping well.
Not enough exercise.
Yep, lots of things.
A lot of folks that come in with these beats, we just ask them to get a little more rest and get some exercise and just gets much better.
Yeah, sometimes I tell
without
them,
any medicine.
Some people want medicine, but I tell them, listen, if I checked out their heart's strong and everything looks like the medicine sometimes are riskier than the skips.
Exactly.
Okay. Shauna, you're on with Dr. Salerno. Go ahead with your question.
Hi. I had a question regarding my dad. He's 76, and he has had chronic atrial fib that just came on. It wasn't like caused by surgery or a heart attack or anything like that. He just discovered it one day when he went in for a cataract surgery. And I was wondering, is there a natural way to convert out of atrial fib?
A natural way?
Yes.
Atrial fib is, that's an abbreviation for atrial fibrillation. Boy, it's so common.
What is it?
It's an irregular rhythm in the top chamber called the atrium. What we really perceive is that the atrium sends heartbeat signals to the main pumps, the ventricles, and that's what we really feel. I'd say, I'm going to guess about a third of people with atrial fibrillation don't even know they have it. They can't feel it. Sounds like maybe your father was that way, that he couldn't even perceive that he had it, and his doctor found it when he had eye surgery.
At first he didn't know, but now it's been about 2 to 3 years now, and he's tired a lot now.
Okay.
Most people with atrial fibrillation, if they're treated right, feel normal. The key things are to control the speed of the pulse, and if possible, get the heart rhythm back to normal. Sometimes we can't, but we should always be able to get people feeling pretty good. The other part of atrial fibrillation is some people with atrial fibrillation are at risk for little blood clots forming in the heart, causing strokes. So some people should be on the medicine we call anticoagulants. The popular name is blood thinners. And again, that depends on the situation. Some people with atrial fibrillation should be on those medicines and some not, depending on their overall health and the health of their heart.
So she asked about, is there any natural thing to get it in rhythm? I don't know of any.
I'm not aware of any natural substance. There's a medicine called digoxin, which is probably the only pharmaceutical agent I know that is actually a plant.
Okay.
It comes from foxglove.
Okay.
But all other medications are pretty much manufactured.
Shauna, what's been tried on your father so far?
He's been on Coumadin, and then he
Okay.
Was taken off Coumadin. He's on aspirin now.
Okay.
His heart rate has always been controlled.
Okay.
It's always been never over the 70s.
Okay.
So he hasn't had to be on any kind of rate controlling
Oh, good.
medication. Just the Coumadin for the longest time, and then the last few months he's been on aspirin.
Okay. Those are all appropriate things to do.
Yeah, so you know, a lot of times people just have to stay in atrial fibrillation. There's just nothing magical.
Well, that you mentioned the word chronic, and that's what that means. That
now, after a while, it's hard to get it back in rhythm, isn't it?
It really is. But as I say, most people feel fine. A lot of people don't even know they have it.
Yeah.
Maybe, whether the tiredness your dad has is from the atrial fibrillation or from some medication or from some other condition, it's hard to know. That's such a common symptom. You almost can't look up an illness in a medical book without associated tiredness.
Yeah.
Just everything from high thyroid, low thyroid, anemia, lung trouble, stomach trouble. Everybody has fatigue from arthritis, fatigue, just such a universal symptom. It's hard to make a diagnosis just from tiredness.
John, has his doctor looked at other things like thyroid and sleep apnea and anemia and all these other things, medicines and those type of things?
Yeah, they've looked at all that, and they've said that it's related to the atrial fibrillation. Because
okay. And how old is he?
He's 76.
76. I guess atrial fibrillation could make you tired a little bit.
It can, it sure can.
Yeah. But it sounds like they're doing everything right, Sean, okay?
Okay.
So thanks for your call.
Okay,
appreciate
thank you very much. God bless you.
Appreciate it. Now, in some situations, okay, we talked about atrial fibrillation, the top part going to the bottom, you want to slow it down. In younger people, sometimes we have some fancy things to get in a rhythm, right?
Oh, there's all kinds of, if we're talking about atrial fibrillation, there's all kinds of techniques to restore the normal rhythm and try to keep it normal once we have somebody back in normal rhythm. And these things go from actually something called cardioversion, which is a fairly common treatment where a person's given a very short-acting anesthetic, IV, then given a shock.
And put it back in rhythm?
It sounds scary, but it's a very safe thing to do, and people wake up, go back home, it's an outpatient job. But the atrial fibrillation could come back, and there are some medications that can keep it from coming back that work quite well. There are things like, there's a term called ablation, which is a method to try to correct heart rhythms by coming up the veins to the heart and isolating the areas of the heart that are causing these heart rhythms and trying to correct it. Atrial fibrillation is a very difficult rhythm to correct with ablation, but it is possible. Yeah. There are many doctors around the United States who do that technique now.
Okay. Well, we're going to stop and hold it there, but yeah, atrial fibrillation, I encourage people, lots of people have it. Find out why you might be in atrial fibrillation, and if you're out of rhythm, get it checked to make sure you don't have atrial fibrillation. We're talking with Dr. David Salerno. Our number is 855-644-3278. Al, stay with us. You're going to be back with Dr. Salerno after this short break.
The Heart of Health Live will return in just a moment.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hello, I'm Dr. Tim Jennings with your Mental Health Minutes. Are you pregnant or thinking of becoming pregnant? Do you want to ensure your child will have the healthiest brain possible? Then avoid all alcohol because as little as 1 glass of wine per week alters brain development and is associated with behavior and emotion problems. Avoid smoking. Children born to mothers who smoked had higher rates of learning and behavior problems and psychotic disorders. Take omega-3 fatty acids. Omega-3s promote healthy brains and higher IQ. And watch out for depression. Untreated depression is associated with delayed fetal growth and altered brain development. However, antidepressants can increase miscarriage rates, contribute to smaller fetal heads, and slow growth in the newborn. If depressed, consider transcranial magnetic stimulation, the only FDA-cleared, drug-free treatment for depression with no risk to the fetus. To be smart requires a healthy brain, so be smart, do right, and make your child bright.
To learn more about mental health, visit comeandreason.com.
Hi, I'm Dr. James Marcum, Speaker, Director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. We're talking with electrophysiologist extraordinaire, Dr. David Salerno. He's brought some interesting things. And why don't you show us the pacemaker again, the smallest pacemaker?
Well, this, okay, Jim, this is a modern pacemaker. It's pretty light.
What's that made of? What's the coating made of?
It's a metal alloy.
Okay. So it's not plastic.
It's really tough. You can't cut into this.
Okay.
It's got a lot of components. It's got a battery, of course. Mm-hmm. It's got a microprocessor that's a little computer.
Wow.
It's got a transmitter.
Okay.
That we can communicate with this unit and see what it's been doing over the last few months.
Wow.
We can make adjustments in the settings wirelessly.
Wow.
And it has, all pacemakers now have a little crystal in them that can perceive when we're active and when we're not, and speed up when we're active like our heart's supposed to do, and then slow down when we're resting. And that little part has made a big difference in the way people feel. Because original pacemakers, such as this big boy here, they went one speed. Let's say they came out of the box going 70. That's what they would do no matter whether you tried to run or play tennis or sleep, it would go 70. And this one will vary its speed depending on what you're doing appropriately.
Right,
so it's made a huge difference in the way people feel.
Now you put a pacemaker in my father-in-law, Arvid. You put a pacemaker in him. How long does it, on average, take to put a pacemaker in?
Pacemaker technology has gotten so nice that now it takes under an hour usually to put a pacemaker in. We use local anesthesia to numb up the area where we put this unit, and some IV medication, sedative and narcotic. People wake up very quickly.
Now we haven't had these. We haven't had these forever, have we?
No. Pacemakers, I guess, started in the late 70s. They were very primitive. Around the mid-80s, it became possible to put them in without opening the chest through the veins. And that's what some of this gear I've got here is. This little piece of plastic has done more to enable this whole field than anything else. A little needle's put in the vein. And then a little wire goes down then through the needle, and this slides, and then the needle comes out and this slides in, then this blue thing comes out, and then we could put this pacemaker wire down this little sleeve and take the sleeve away, Now the pacemaker wire's down in the heart, and you can see they're like cooked spaghettis.
Yeah.
They're little slinkies, basically.
How do you get them to stay still?
They're metal coils. Yeah, you can't really put them in this way. There's a stiffener that is put down the center. This is just a fine metal. We call them a stylet, but they're a fine metal that stiffens this up, and then we take this out, and then we hook this up to this. Goes in a little hole right there, and there's a model. A real one would have a little set screw there, and that's all inside, and off it goes. Not too hard, very low risk. Nothing zero in this world, but pretty low risk.
But what happened to patients that didn't get pacemakers before we had pacemakers?
No,
they didn't do good, did they?
They would get ill and ultimately pass away from too slow of a heartbeat.
So I'm glad we have those.
No, these are a wonderful, wonderful thing.
Okay, I'm Al. You're on with Dr. Salerno. What's your question this evening? Al, you there?
This is Al.
Go ahead, Al. You're on with Dr. Salerno.
Right. Occasionally taking a heavy load of laundry down the basement steps or a couple armloads of groceries, I will notice that my heart starts to beat really hard. It doesn't speed up. I don't break into a sweat or anything, but it just about wants to pound out of my chest, for lack of a better phrase. Could you give me some idea of what that could be related to?
Yeah, I hear that symptom pretty often. It can be a variety of things. Maybe the most common reason is high blood pressure. I don't know if you have high blood pressure, but your heart sounds like it's really beating hard. I keep saying this, but your doctor can figure this out pretty easily. By one way is to put you on a treadmill and have you do exercise and
watch it.
See what your blood pressure does and see what your heart rhythm does, and he can figure out which of those two is actually causing you to have that feeling, and then the treatment would, if any's needed at all, he'd know what to do.
Yeah. Are you an exerciser, Al? Do you like to get out and do exercise?
Well, to a limited degree, I have a bad back, so kind of limits what I can do.
You know, some people I've seen that don't get out and exercise and might not be in great shape when they overdo it,
Heart
the heart has to
work.
keep it. Yeah,
if your back's bad, some people get in the community pool, the Y at the Y, some things. That's pretty good for people with backs. Get your back in shape. You might, though, think about just chatting with your physician to see if that's appropriate for you, or if he ought to do some kind of test for you to make sure you're okay before you do a lot of exercise.
And if you're passing out, that would be dangerous, right?
Yeah. Oh, yeah.
You're not passing out, are you, Al? Al, you still there?
Well, we don't have the best connection here, I guess.
You're not passing out, are you?
Oh, no, not
just
not
the pounding.
Like that.
And does it stop when you
wait for it to settle down? But I don't feel like I'll pass out.
Okay. And does it stop after you get up to the top of the stairs? After you do
it will calm down. It has to take about 5 minutes or so to, just me not doing anything. But I don't know what to attribute it to. I'm not carrying that heavy loads. So, and actually, it was when I was going down a flight of steps rather than up. So I didn't think that would tax the heart all that much. But who knows?
Well, hopefully it's just being out of shape. I hate to say that, but because that's not an illness, and we do see this when we're out of shape, that our whole body has to work harder when we exercise, and a lot of us can notice that as a pounding. But as I say,
to a degree, then
it's pretty easy to look into this. If you're concerned, it might be something else.
Okay. Well, we wish you well, Al. Okay.
Right. Thanks very much.
Okay. We've had some questions that's come into our website. That's heartwiseministries.org. And one of the people asked, is ginger root a blood thinner? Well, it's not one that we would use for a condition like atrial fibrillation. And we get these questions a lot about natural blood thinners, and unfortunately, a lot of them have not been studied. So we just don't. So that would I don't think ginger root's a known blood thinner. So we got that one.
So some of these supplements, I call them, do have some very modest effects on blood clotting. But we don't know for sure, but probably not enough effect to protect people who need protection from blood clots forming in the body.
And I do wish we had studies that show, especially in the elderlies, if there were safer things than cumin to use.
Right.
One of the ones I get asked about is one called nattokinase. It's a blood thinner, but the studies just aren't there.
No.
We do know that drinking adequate water helps thin the blood a little bit too. So we don't want thick blood. We still have a short time left with Dr. Salerno. Give us a call, 855-644-3278. Another thing you can do is if you want to keep a track of the ministry, become one of our Facebook friends. We have lots of people on Facebook that interact with HeartWise, or you can go to our website and watch this program over tomorrow. If you didn't catch it this time, you can watch Dr. Salerno again on our website. That's heartwiseministries.org. And Michelle, thank you so much from New York for being so patient. After this break, we're going to come back and Dr. Salerno is going to answer your question.
Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said, or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that HeartWise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support HeartWise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Dr. Salerno has graciously given his time here to help us answer questions from all over. Michelle, you're on with Dr. Salerno. Go ahead and ask your question.
Oh, thank you so much. Can you hear me okay?
Yeah, we hear you great.
Mm-hmm.
Okay, awesome. My son is 9 years old, and since he was, I guess, well, I mean, as long as I can remember, he had an irregular heartbeat. And it was not picked up by the doctor, so he used to play with my hair with his fingers, and I would lay on his chest, and I heard it, and I said, oh, my. So I brought him to the doctor, and they said, maybe it's PVCs. And I went to a cardiologist, and they said, you know, she listened to him. She was very reassuring. And she did an echocardiogram, and there was no mixing of the oxygenated and non-oxygenated blood. And she put him on, and she felt, you know, she heard it,
but she was very not alarmed by it, and she put a Holter monitor on him. She watched him for like a year or two, and she said he was okay. She said, let me just put a Holter monitor on him. And so when she called me back after I submitted the 24 hours, of the Holter monitor, and they analyzed it, she said that they saw 300 and something PVCs. I thought I was going to pass out. I said, oh my God, that's so many. And she said, no, that's actually not that bad, and it's nothing to worry about. And so I always wanted to ask somebody if that was, if that was an eyebrow raiser or not. And so when I saw you on TV just now, I said, oh, well,
yeah.
Maybe I'll ask you.
No, that's a good question. This is going to amaze you, but our heart beats about 100,000 times a day. 100,000.
Wow.
It beats 60 times a minute, or 70 on average, times 60 minutes in an hour. There's 4,000 something in just an hour. And it does that every day of our life. In 10 days, 1 million, and a month, 3 million. And children go faster.
Yeah.
As it turns out, almost all of us have PVCs. 95% of us do. And if we put a monitor on the next 100 people going by, 95 will have PVCs, up to about 100 a day. And of those 95 that have them, 5 or 10 will have up to 1,000 a day. So 300 in adults falls inside the normal range. I'm not a pediatric doctor, but I think that's probably okay for children too. If his echo is normal and he feels good, and he sounds like you've got a really pretty good doctor there, I bet he's totally safe. But we see PVCs on almost everybody. It's amazing.
Okay.
What those mean for people who don't know what they are, they're premature beats. That's the P, coming from the ventricle. That's the V, and the C stands for contraction, premature ventricular contraction, early beats in the ventricle. We used to think they were very dangerous, but turns out they're not.
Yeah. Well, thank you for calling us, Michelle.
Well, if it turns out they're not, that's fantastic. Thank you so much.
Yeah,
you bet.
Sometimes people just need a little reassurance.
That's very true.
Just reassuring this, and hopefully their PVCs will go down with a little reassurance. Yeah. Believe me, we're almost out of time. We had one person that wrote in that says, what tests can be done to help extend longevity? So what would you recommend for that?
Well, it depends on your age and gender. It could
This
be
is
a
62.
pap smear for a lady or a prostate check for a guy.
But for sure, see your doctor.
Yeah, see your doctor.
You take your car in every year, take your body in, get it looked at.
Yeah, change your oil.
We want to thank Dr. Salerno being with us on Heart of Health Live. We'll have him back again. And in the meantime, you can send your questions to our website, heartwiseministries.org. You can become one of our Facebook friends. And we want to wish you the best of health and wellness as you continue your lives. Thanks for joining us today. And with special thanks to Dr. Salerno.